everybody's excited about Hump Day. We're halfway through the week. The weekend is closer and closer. In today's video, we're going to talk a little bit about trauma, what it is, what it's not, and the type of care that you should seek for traumatic events. Now, SAMHSA, which is one of the nation's most forward agencies in mental health care, which I actually worked for them when the triangle first was starting to explode down here in North Carolina. SAMHSA defines trauma as an event or a series of events or circumstances experienced by an individual or individuals as physically or emotionally harmful that has lasting adverse effects on the individual's functioning and mental, physical, social, emotional, or spiritual well-being. Individuals can suffer trauma from something like a car accident or the death of a loved one, or it could be something as simple as changing jobs, changing schools, pandemics, or other type of like trauma like racism, sexism, bigotry, and bullying. So that is the formal definition of trauma. Now, inside that definition of trauma, there are different things that happen in the body when trauma is experienced. For the most part, most practitioners recognize like the simple fight or flight response to trauma, which is, again, it's a very simplistic thing, but that's what our body does. When our body faces anything that it interprets as a threat and causes a trauma, you're going to see a response or fight or flight. Actually, there's a little bit more than that. So the first thing is you cannot understand trauma cognitively, and especially how a person will respond to trauma and post-traumatic stress disorder in a simplistic way, or in a cognitive way. You cannot rationalize it. When we are traumatized and we react, what our body is doing is it bypasses the functional brain and it activates what a lot of people call the lizard brain, or kind of like the part of the brain that is very instinctual, very animalistic, and reacts to the threat without analyzing, rationalizing, or any thought process. It's just a very quick reaction, which can go from anywhere from fight, flight, fawn, or annihilate. Oh my god, I can never pronounce that word. Annihilate, whatever. But those are usually the reactions to a traumatic event. Now, somebody that went to war, obviously we would recognize that type of trauma and validate that type of trauma with no issue whatsoever, because that sounds extreme. So to people, trauma should be extreme. However, that's not how that works. There are simple events that can actually traumatize a person and trigger eventually behaviors and issues like post-traumatic stress disorder, like bullying, for example, or even simple things like, for example, I definitely have a trauma response to dentists anymore. And it's not because of the pain. It's not because I don't tolerate. I've never had an issue with that. Like, you can sit there, you can drill, poke, probe. It doesn't really bother me. What created the trauma was I started suffering and I didn't know what was happening with my body. And I started suffering and I started losing bone. I started losing teeth. And every specialist that I went to, everybody had these fantastic answers and solutions, and everybody is like, I'm going to help you. I'm going to be the one person that helps you and gets it right. And every single time, it did not work that way. It went Murphy's Law type of thing where, everything that could go wrong went wrong. And this kept happening and happening and happening. So now, when I have to go to an appointment, when I have to see a dentist, my brain can rationalize where it's coming from. If I'm calm, if I'm calm and regulated, my brain can actually say, Shayla, hey, you developed an emotional injury because of the expectations, because of all the disappointments. I can rationalize that right now during this video. However, if I was driving to a dentist appointment right now, I would be a hot mess. And by the time I get to the office, if I don't have some sort of support, I can barely get through it. Actually, very recently, when I was working with Dr. Mohandesi and her team at Rockville, Maryland, at Smart Arches, it was very difficult. And this is a very empathetic doctor. I mean, she is an angel. And my mom was in most appointments too, and I was still freaking out. There was one of the appointments that they had to take a particular casting, and I kept trying to push myself, because sometimes you have to metabolize trauma and have your body go through the process. But that being said, even with all of those supports, my lizard brain activated, and the dentist kept asking me, Shayla, are you okay? Shayla, are you okay? And I'm like, yeah, I'm good. Yeah, I'm good. And next thing you know, I was about to pass out. I literally thought I was going to pass out. So that is obviously a fawn response to trauma, where your rational brain was trying to work through the process, and the lizard brain engages and starts sending alarms, and you fawn. You fight, flight, fawn, or annihilate. There you go. So a lot of the things in terms of caregivers, direct support professionals, counselors, all of that, first responders, those are very traumatic jobs, just the nature of them. You are seeing human beings at their most vulnerable, at their moment of struggle, at their moment of tribulation, whatever the case might be. And a lot of the times, especially those of us that come from the old school, we were never encouraged to recognize that trauma and metabolize it and work through it. We were never, even when post-traumatic stress disorder came into the DSM and came into the picture, it initially was a very rough, bare bones, very niche type of diagnosis. And then we started learning that within the post-traumatic disorder, there are different responses. So, for example, a lot of the times, somebody that went to a conflict, a war, or regional conflict, that type of stuff, maybe a cop that was intervening in a riot, things like that. The old school way was, you end your day, you go out with your boys, you get a couple of beers in your system, you make a couple of dark, unsavory jokes, and that's how you got through it. That meant you were strong. You can handle this stuff. But for soldiers, for example, a lot of people never thought about moral injuries, which can create a crazy amount of cognitive dissonance. Because if you're sending somebody that is spiritual, religious, where their religion has deemed that taking a life, or the act of engaging in taking lives, it's a sin, but they have a very strong commitment to defending their nation, their loved ones, Now they created a trauma around that because they cannot reconcile that my religion dictates this, my government kind of used me, and now I'm just left in the wind. So that's why it's so important to find, when you are in any of these positions, when you are a first responder, when you are in the military, when you are a counselor, when you if you work with any population that has mental health, behavioral health issues and stuff like that, it is very important not only to practice self-care, but find, especially if you're experiencing burnout and getting to that point, it is extremely important to find a professional that is versed in trauma-informed care and can help you navigate those triggers. Because trust me, it's going to happen throughout your life, and it doesn't always make sense. It really doesn't always sink in that the reaction you're having to this particular emotion or situation or interaction might be rooted in a past trauma or a past situation that you have not yet processed. So again, trauma-informed care deals with trauma from a different perspective. Yes, you can do talk therapy, that's part of it, but that's more of the rational part of it. Trauma-informed care will most likely have some sort of body work attached to it, like meditation, progressive muscle relaxation, play therapy, dance therapy, horse therapy, because you have to engage the lizard brain and kind of like get it back to that discomfort and help your body settle and sit with that discomfort until the brain can understand that this is no longer a threat and it doesn't require that huge reaction that you're getting. And trust me, this can happen anytime, anywhere, and you can have the most weird reactions. Like, it could be something as simple as you're putting an order and somebody kind of like raises their voice at you a little bit and appears frustrated. And if you were a child that was raised in a home where there was constantly arguments and loudness and you just always felt like things were unpredictable, obviously the person that is giving you the coffee and maybe had a minor attitude trigger that traumatic response, because your body doesn't know that these are two different situations. It's only interpreting what you feel, what you sense. So that's the difference between normal therapy and trauma-informed care. So for all of my caregivers out there, for all of my peers, all my first responders, all my direct support professionals, make it a point to find a good therapist that is versed in informed trauma care and make that part of your routine of self-care. It will make you a better professional and you will see better outcomes on your patients, on your loved ones, and those you care about. As always, stay happy, stay healthy, stay safe, lean on each other, and I'll be talking to you guys very soon. Thank you.